All right, we'll go ahead and get started. Thank you all for being here for the Wednesday COVID-19 media briefing. On the docket today, we'll have the Executive Director from Immunize Nevada, Heidi Parker, and then followed by Kevin Dick, the District Health Officer for Washoe County. We'll go ahead and start it off with Heidi Parker. If you're ready, please unmute. And
hi, everyone. Thanks, Scott, for having me today. So Scott asked me to just join and give a few updates, and then I'm happy to answer any questions, obviously along with Kevin. So our first update that Immunize Nevada has is we, in partnership with the Nevada Minority Health and Equity Coalition, are launching the Nevada Vaccine Equity Collaborative. There'll be more to follow about this initiative, but it does follow the governor's initiative that he recently announced as a priority for vaccine equity. We are really going to be working with the coalition to just ensure that as we are moving through priority groups in the general population, that there is really no wrong door for vaccine access, that sometimes equity looks different depending on internet access, your zip code, et cetera. And so we're taking all of that into account with this collaborative, and we're excited to launch, and we'll be sharing more with you in the next week or so. And so that's our main update. We also just are in a non-COVID-19 vaccine topic is we are starting to really look at back to school initiatives, and we want to be getting the word out to parents earlier than later about getting back into their providers' offices for those routine childhood immunizations, making sure they're not waiting if they're concerned about cost or they have maybe lost their insurance during the pandemic. We are here to provide those resources and referrals for them. But we know that there are a lot of routine childhood immunizations that need to be caught up. And we want to make sure that parents have enough time to do that over the next few months to avoid what we all know is typically a back to school rush. So we will be starting some efforts around that, more to come, but planting the seed now so that we can help parents be ready. Scott, I think those are my two main updates.
all right, thank you very much, Heidi. Appreciate that. We'll now move over to Kevin Dick, District Health Officer. Kevin, if you're ready, please go ahead.
Yes, thank you, Scott, and thank you, Heidi, for joining us today, and to all of our media partners for your continued coverage. Yesterday, we administered just under 1,500 doses, 1,494 doses of vaccine. That was about evenly split between first and second doses, which we were administering at the pod at the Reno Livestock Event Center. And we at the health district have vaccinated nearly 38,000 people, or vaccines, nearly 38,000 vaccines administered to date. And that includes 14,186 individuals that we have fully vaccinated through the health district with the receipt of their second dose. The state reported earlier today the totals for Washoe County for vaccine administration, and the county as a whole is at 92,732. That's over 31,000 individuals that are fully vaccinated. So the percentage of our population that has received the first vaccine is at 12.86, so almost 13%, and about 6.5% of the population that is fully vaccinated with the second dose as well. So I want to thank all of the health district staff and our partners that have been operating at the pod and our testing operation also at the Reno Livestock Event Center. They worked through President's Day holiday and have been keeping things moving through some very challenging winter conditions to ensure that people are receiving their vaccine. And I want to also thank those that have reached out to acknowledge their appreciation for the work that crew is doing. So we have the National Guard involved. We have CERT volunteers. We've got the Medical Reserve Corps volunteers who are continuing to show up and get the job done in challenging circumstances. We have been working to make sure that our 70 and older population have the opportunity to be vaccinated. And so we have sent invitations for scheduling for vaccines to over 7,000 seniors in the last week. And we were also focusing on seniors that had provided us with a phone number that didn't have internet access and the technology solutions for getting scheduled. So we had our call center active in calling over 2,000 individuals to work to get them scheduled through our Livestock Event Center pod. Also want to acknowledge the work of our community partners in fire, Renown, Community Health Alliances, and our pharmacies for their efforts with the vaccinations. I'd like to encourage everyone who knows somebody that's in that 70 and older group to reach out to them and make sure that they are able to get vaccinated, or checking their emails to make sure that if we are sending them something, it doesn't end up in their spam folder that they miss, and that they follow up on the email by getting scheduled, or help them give us a phone call at 328-2427 to be scheduled. We are working with the state and hope to have a number soon for how many seniors have been vaccinated in Washoe County, as well as other demographic data. However, we have to rely on the state to extract that from the database to provide to us. We're making good progress in moving through our community frontline support groups. So we've now started vaccinating veterinarians who are caring for service animals, frontline state service staff, and moving on to mortuary services and other essential transportation. So we're making good progress as well with the essential workforce lane. And we're beginning to get organized with some of the frontline supply chain and logistics organizations so that they're ready to get vaccinated when their turn is coming up here soon. We do have some delays in vaccine delivery that you've probably seen reported in the news that are occurring nationally because of the huge weather system and impacts that we've seen across the country. So we did receive our Pfizer shipment this week, but we are still awaiting our Moderna shipment. And we have adjusted our scheduling for the vaccine to be shifting to make sure we're utilizing that Pfizer while we're awaiting the Moderna. And we're also working to try to support our partners, make sure that we have second doses available for those that need it, and we can keep schedules moving for the vaccination. Wanted to speak also about the potential for variants in the community. I had reported previously that we suspected that we had the UK variant here based on people's travel histories to Washoe County. And the state lab is continuing to work on genomic sequencing to be able to identify variants. I'm aware of a rumor that a resident has contracted the South African variant of COVID-19. And I can comment that we have had a traveler return from South Africa, and they did test positive for COVID-19. And the state lab is looking into whether they may have the variant or not, but we don't have any confirmation at this point that they do have the variant. What we do know is that they were not contagious when they were traveling. And so we don't know when they contracted the virus, whether it was in South Africa or during their travels or elsewhere. So we'll await any confirmation regarding that from the state lab before we presume that we have that variant in that case. That said, though, we do know that the variants are out there. We do have international travel occurring. We also have people in this country that have tested and have the UK variant that have not traveled, don't have that travel history. So we can presume that if we don't have the variants here now, we should have them happening here just because of how this virus spreads and transmits so readily already, and that these variants have the potential for increased transmission. And while we've seen some encouraging news with our numbers, we're down to an 8.9% positivity rate for our test results, and we're at 44.1 new cases per day on the 7-day moving average. Our active cases are down below 7,000. Those are all good things for our community, but it's essential that we continue to wear our masks and socially distance to continue to reduce the transmission of the disease, and to also do that to prevent a surge happening from these variants that could be impacting us and increasing transmission rates. I think it's important that we learn from our past experience, as we've seen relaxations occur in the mitigation measures that have been put in place. People take that as a positive sign, and they think everything's getting better, and they relax their practices with the masking and social distancing. And we need to make sure that we are unified in our approach in wearing masks and social distancing and continuing those practices, so that we can be successful in opening up our economy a little bit more instead of hurting ourselves when we do that. And so I have heard the reports that some businesses are under the impression that masks are optional now, that the governor has relaxed to the 35% capacity limits on some of our establishments. And that is not the case. The masks are still mandatory under the governor's directive. The social distancing requirements are, and those will remain in effect, including beyond that May 1st date, when the state will be reverting some of the decision making back to local governments. And so we need to ensure that we're doing those practices to prevent the transmission of the disease. The fact that we have people that are getting vaccinated now is great news, but we are nowhere near the percentages that we need of people vaccinated. So please encourage everybody that you know to continue to mask up, to wash hands, to socially distance, to protect one another as we move through this. And you know, the potential that we could have additional surges and additional hospitalizations and deaths is a very real reality for us, and we need to continue to be careful. So with that, I'll turn it back over to you, Scott.
Thanks, Kevin. We now will open up to the Q&A for both Heidi Parker and Kevin Dick. So if you have any questions, please go ahead. Go ahead, Bert, if you're ready.
Oh, thank you. And thank you all so much for hosting this today. I just wanted to know if there was any updated race or demographic information about who has received the vaccines in Washoe County thus far.
I'm sorry, but I don't have any updated information, and we're working to get that from the state. That is input into a system that's called REDCap. And we don't have access to pull that information out, but we're working with the state to try to get that, and we'll report that out when we have that information available.
Thank you.
Hey, this is Lucia Starbuck from KUNR. Can you break down, I guess, how long has Washoe been in this downward trend, and then I guess why it isn't time to relax yet?
Well, the Washoe County has been in a downward trend, I mean, roughly since the end of November, when we were hitting our peak in the surge. And we are relaxing under the governor's guidelines. We are moving from the 25% occupancy limit for restaurants, bars, gyms, spas, gyms, casinos, some other types of businesses. We're moving from 25 to 35%, and for other businesses up to 50% capacity. The public gathering limit has moved from 50 to 100, or 35% of capacity, whichever is less. So those are relaxations that are occurring because of the reduction of the number of cases that we have occurring. What we can't do is relax what we need to do with the masks and the social distancing, because that is what we have that can help prevent the transmission of the disease. And we need to be particularly careful that we're doing that as we are having more density in the number of people that we're allowing into enclosed areas where we know there's a higher potential for the disease transmission. So we are relaxing to try to keep our economy going, but we can't relax what we're doing to be careful with our masking and social distancing.
Thanks. And just as a follow-up, just circling back to what you said in the beginning, that we have been in this downward trend since November, and I guess that's surprising to hear considering we had the holidays in the middle there.
So what we saw happen here in Washoe County is we really took off from mid to late October through November. And so I think we saw a lot coming out of Halloween and Nevada Day celebrations. And then I think what we saw was some numbers that were quite startling that were happening in November coming up to Thanksgiving. And I think that that helped get some people's attention that these past practices of gatherings were not a good idea. And while we did see some leveling out and maybe just a slight increase in our decline that occurred in December following Thanksgiving, it wasn't enough to cause a significant new spike. So I think that the holidays, Thanksgiving, Christmas, et cetera, kind of moderated the decline a little bit, but fortunately we were able to continue with that decline to where we are now.
Thank you. I'll jump in with a follow-up. With being on this decline, are you guys bringing back contact tracing questions that were kind of cut in early December?
We're getting caught up with the contact tracing, but I think we're still trying to manage the level of detail that we're conducting in those investigations to make sure that we are keeping the time that we spend per investigation down to a manageable level so that we can continue to stay on track and up to speed with our disease investigation and contact tracing.
Thank you.
You bet, Lucia.
Any other questions for Heidi or Kevin?
Scott, it's Heidi. I just wanted to share, if everyone didn't see the press release that was came out just before this, is the state dashboard is now going to be updated on Monday, Wednesday, Fridays. So I think that's, again, a move to increase sharing of data, as Kevin mentioned, and getting more information out there. So just reminding everybody that that did come out just before this, and looking forward to seeing those increased numbers.
Any further questions? Okay. Thank you all for being here today. This will be recorded and put on YouTube later today. Thanks again for Heidi for joining us, and we'll see you all next time. Thank you.
Thanks, Scott.
Thank you.